Welcome to this tutorial video. So this particular video is for those that will be writing their final examinations tomorrow in human anatomy. So as you can see, this particular video or session is basically just going to guide you on how you must approach your final examination, on which topics you must focus on the most, and the things you must look out the most as you are doing your final revisions today. So as you can see, the title is Final Examination Guide, specifically in human anatomy. Remember, I've said this is for those that are writing their human anatomy examinations tomorrow. So basically, we are going to look at the topics that are going to cover your exam, or like the entire coverage of what you covered, okay, in class. So we're going to go through each and every topic. Then I'll basically talk about things that you must not miss out as you do your final revisions. So this is what this particular session is all about. Okay, so we're going to start. So you know that human anatomy starts with the introduction to human anatomy. That is the first topic that you covered. So in the introduction to human anatomy, these are the things that you must really make sure that you know them before you go into that examination room. Number one, the definition of human anatomy. So you have to know what is human anatomy, right? And its branches. For example, you know that human anatomy has to do with the study of the structures of the human body and how these structures are related to each other, right? That's what human anatomy or this particular course is all about. You also have to talk about the branches of human anatomy. There's what we call gross anatomy, where you look at an individual human being at a gross view or at a macro view, a larger view. You look at the whole entire body, right? Okay? Then there's also what we call microscopic, where you look at small things that you cannot see with your naked eyes that are found in this particular individual. And then there's also which we call, developmental anatomy. There are different branches of specific fields of anatomy which somebody may, major in. You have to review those things. Apart from that, you have to talk about, or you have to make sure that you study about the anatomical positions and the directions. Moving the arms forward, facing the assessor, those things that we talked about. Make sure that you know the anatomical position and the directional terms. Especially if you're talking about directional terms, you have to know what superior is, what inferior is, what medial is, what proximal is. Okay? So you make sure that you review these things, you know them very well. You also have to know the body planes, the transverse body plane, the sagittal body plane, the oblique body plane. You have to know, including the other names. Make sure that you review them and you know these different body planes. Okay, they also come. And then apart from that, you also have to talk about, you also have to review the structural organization of the human being. So they start from the chemical level, cellular level, tissue level, organ level, system, and the actual organism. One thing I will tell you is that when you are starting a topic for the exam, do not underestimate any topic. Everything is important. So make sure that you cover this. You also have to review the body cavities, just in general. Of course, the cranial cavities, thoracic cavity, abdominal cavity, and other different cavities that we talked about. Okay, of course, I know to be specifically there are other cavities such as the pericardial cavity. All those, you have to know them, that where they are located and where they are found. So this is basically what you have to know on the introduction to human anatomy. One thing I'd like to mention is that these questions, or this guide that I'm giving, these questions may come whether on multiple choice questions or MCQs, or you can find them in one word answer. Sometimes diagrams can come. She can just maybe bring diagrams on how you are supposed to label the body planes. That may come. So this is human anatomy from the word go. As you start revising, make sure that each and every topic, look for a diagram that was included in the notes for that particular topic. So on the introduction part, this is what you have to know. Of course, I believe that after looking at the introduction, you also looked at the cell. So it's in human anatomy, before you even go into major things talking about the systems, you have to know the animal cell. So you talked about the cell. In human anatomy, you have to know the structure of the cell membrane. Remember the structure of the cell membrane, the phospholipids, the glycolipids, the transmembrane proteins, all those, the integral proteins. Make sure that you know the structure very well. Of course, maybe talking about the transportation mechanisms such as diffusion, osmosis, and active transport, these may really have to do with physiology, but at least use the same information that you know in physiology to be able to apply it in human anatomy in case questions come on diffusion, osmosis, and the active transport. I emphasize, know the structure of the cell membrane. Also, since we're talking about the cell, you have to know the organelles and their functions. So this particular cell has got the nucleus, the mitochondria, rough endoplasmic reticulum, the Golgi apparatus, the lysosomes, the ribosomes, all those different components, the centrioles, all those different components of the cells. You have to know what specific function do they perform, because questions can come on what each and every organelle does. So make sure that you know the functions of different organelles. You also have to talk about the cell cycle. This is very, very important. I don't think there could be an exam that would include the entire exam if we're talking about mitosis or meiosis. You have to know mitosis and meiosis. Okay? Make sure that you review the notes that we covered. You review the past paper questions that I sent on mitosis and meiosis. Make sure that you know the difference. Remember, mitosis has to do with the growth, okay, or divisions of cell which bring about reproduction of two identical daughter cells that are same with the parents. Remember that meiosis has to do with the gametes production, sex cells. Remember those things. Also, just talking about the basic, genetic information that is found in this particular cell. Of course, DNA and RNA, these are very, very vital because they bring about, if you're talking about the actual cell cycle, okay, talking about protein synthesis, these are the genetic, materials that are found in this particular, context. So make sure that you know these things about the cell. Apart from that, talking about the human basic tissues, I recently uploaded videos on epithelial tissue, okay? I also uploaded the recent video on nervous tissue. So you have to know the 4 basic type of tissues in the human body. The epithelial tissue, know the types of epithelial tissue. Those types like squamous epithelium, stratified, columnar, pseudostratified columnar, all those different types, know them. The functions of epithelial tissue. What does epithelial tissue does? You have to know the functions. The location. They're going to ask you what type of epithelium is found in the blood vessels, for example. You have to know the actual type of epithelium that is found in the blood vessels, right? You have to really know that. Know at least each and every system. If you're talking about maybe the urinary system, what kind of epithelia is related, maybe found in the urethra, right? You have to know those things. If you're talking about the reproductive system, what type of epithelia is found in what? In the genital organs. You have to know those kind of things. Apart from that, you also have to know that epithelia, of course, is generally described in terms of covering epithelia and the glandular epithelia. So you also have what we call glandular epithelia, which forms glands, right? Know the types of glandular epithelia that are there. Know the type of secretions that are, made in this particular glandular epithelia. Not just talking about the exocrine glands, but also talking about the endocrine glands. Talking about connective tissue, there is loose connective tissue, dense connective tissue, the cartilages, the bone, and the blood. You also have to know these different concepts. Talking about the muscles, we're talking about muscle tissue here in general because muscle tissue is just a tissue just like any other tissue, right? It forms the muscles, right? Of course, you've got 3 different types. You've got the skeletal muscle tissue, the cardiac muscle tissue, and the smooth muscle tissue. The skeletal one, of course, covers the skeletal system. Then the cardiac one, of course, in the heart. Then the smooth one, of course, in the, somatic, body organs or just internal body organs, right? You also have to talk about the nervous tissue. I talked about the neurons and the neuroglia recently. Talk about the classifications, the type of neurons, the bipolar neurons, the unipolar neurons. Make sure that you know all those different things. So remember, everything I'm talking about, these are the major things that you must not miss as you do your final touches, as you do your final revisions on each topic. Make sure that you know these things. Apart from that, you also have to know about what we call gametogenesis. There's a full video in my playlist that is talking about gametogenesis. What is gametogenesis? You know that this is basically a process that involves the formation of gametes, both in males and in females. So in males, we call it spermatogenesis. In females, oogenesis. Talk about location. Where does this particular, process takes place? there is a full video on gametogenesis in my video playlist. Make sure that you watch it. Talk about the stages and the timing. They'll ask you, is oogonia present at birth, for example? You're going to say no because you understand that oogonia is not present at birth. They'll ask you, when does spermatogenesis starts in, of course, if you're talking about spermatogenesis, that is in males. You have to know when does it start. Of course, at puberty. Know how the actual cycle takes place from the primordial germ cells to forming oogonia if it's in females, okay, from oogonia to the primary oocytes to the secondary oocytes, and how it links this particular cycle or process to the menstrual cycle. You have to know all these different things. You have to know that meiosis is the one that is used in gametogenesis, both in females and in males. Make sure that you review these key concepts on gametogenesis. Apart from that, you also have to talk about or review the menstrual and the ovarian cycle. This is very, very important because this builds, especially those that will be, in their third years, next year, the midwifery students, you will now start doing things that have to do with midwifery specifically. And this is one of the topics that will really go into details. Okay, so you have to know the menstrual and ovarian cycle. I think I taught about this. The videos are there in my playlist. You can review them. You have to know that ovulation occurs mid-cycle. Like for example, we're talking about an average 28-day cycle. It occurs at day 14 due to what? Surge or increase in what? Estrogen hormone. I talked about this. You also have to know that progesterone dominates the luteal phase and stabilizes the endometrium. Remember, during the luteal phase, when the corpus luteum has released, when the corpus luteum has, of course, we're talking about the Graafian follicle, which has released the ovum, it's now turning into what we call the corpus luteum. It's not going to die until those 14 days to be able to resume or to be able to restart the menstrual cycle. And it's the one that brings about production of what? Progesterone. These questions come, trust me. So you have to know what this progesterone does. Of course, we say that it stabilizes the endometrium lining, of course, and especially for what? For pregnancy. Menstruation. You know that this results from the drop in estrogen and progesterone. Yes, this is what brings about menstruation. If maybe you're confused about how this is coming about, review my videos. Okay? Then talking about follicle stimulating hormone, you can't leave this particular hormone when you are talking about the menstrual and ovarian cycle. This is the one that brings about follicular development. Okay? It stores, of course, estrogen as well as progesterone, right? Because we're talking about the follicles that the one that produce progesterone as well as estrogen. Apart from that, you also have to just at least know that follicle stimulating hormone and luteinizing hormone are coming from the anterior part of the pituitary gland, that the one that influence the menstrual and the ovarian cycle. Apart from that, you also have to, review what we call the fertilization process. You have to review what we call the fertilization process. So, if you're talking about fertilization, of course, I know you know this kind of concept. We're talking about, the fusion of the male and, female gamete to be able to form the zygote. In human anatomy, they're interested in you knowing where does it take place. Okay, of course, it takes place at what we call the ampulla of the fallopian tube. I think in my video for the menstrual cycle, I talked about this. I think I even showed you where this particular, site is. Talk about capacitation and the chromosomal reaction. If you're talking about the phases that takes place in fertilization, you have to talk about capacitation. Okay, you have to talk about the acrosomal reaction. Okay, make sure that you know how to define each and every term here. For the sake of time, I'll not really go in details talking about each and every concept, because that is going to create a very long video. But I'm just trying to guide you on things that you must not skip. Talking about zygote formation and early cleavage. If you're talking about formation of the germ layers that will now come about after the formation of the zygote, you have to know those different concepts. Talking about implantation and formation of germ layers, just like I said, make sure that you know these different things. And like I stated, so here there are diagrams. There are diagrams that you must know in fertilization. I think for my students that are with us in SPA, they know those diagrams that I'm talking about. Okay, I think even those diagrams I sent them, you know the diagram that you're supposed to know on fertilization. Apart from that, there's also the integumentary system. Here, make sure that you know the layers, the epidermis, the layers of the epidermis. If you're going to use the mnemonic, if you want to summarize the layer that you find in the epidermis, the stratum corneum, the stratum lucidum, granulosum, spinosum, basal, make sure that you know all those different layers and how they are, arranged. Okay, talk about the epidermis, what you find in the epidermis. Make sure that you know these different, layers. Talk about the hypodermis. What do you find in the hypodermis? That is very, very important. You talk about also the skin appendages like the hair, the nails, and the glands. Sebaceous glands, sweat glands, merocrine glands, all those different glands, you have to know them. Okay? You also talk about the functions of this applies to each and every system. Each and every system has got specific functions. So make sure that you know the functions of each and every system. For example, you are saying that on the integumentary system, it's used for protection. Yes, because the skin acts as the first barrier. It's part of what we call the innate immune system. All right? The innate immune system, or non-specific immune system. Thermoregulation, of course, because of the fat stored in the skin, it brings about, insulation. Of course, sensation because of the nerves that you find in the integumentary system. Okay? So, also know. And most importantly, as you are talking about the systems, it's very, very important that you have to at least just even have an idea of clinical application of each and every system. Because the reason why you're covering these systems is that at the end of the day, when you become nurses or midwives, you must apply the knowledge you've obtained in this human anatomy to be able to give appropriate care to patients. For example, talking about the skin, you have to talk about the bands. The bends. Okay, if you're talking about calculating those that have done adult surgical nursing, they will be really familiar with this. But don't worry, we're going to do it next year. All you have to know is that when a patient or when a client is bent, right? Of course, what is damaged is the skin. So if you know to say if the skin is damaged, to what extent? Is it the epidermis? Is it the dermis? Is it the hypodermis? This is the clinical application. Of course, there's also what we call, melanomas or skin cancer types that may come about due to damage or destruction or any abnormalities that can take place in the skin. So you have to really know those clinical applications, at least just having an idea of what they're all about. Apart from that, the skeletal system, okay? So you're supposed to talk about bone classification. Of course, there are long bones, short bones, flat bones, as well as what we call irregular bones. There's also what we call sesamoid bones. Okay, the 4 classifications here. You have to know how they look and how they are different. Okay, even possibly where are they found. Structure of long bone. The long bone is what comes, you talk about the diaphysis, the epiphysis, and the bone marrow. And I'll remind you that the epiphysis, this is where, bone growth takes place. Okay? Talk about the bone cells. So the bone cells, we've got the osteoblast, the osteocytes, and the osteoclast. These are the cells that you find in the bone, of course. Ossification. You're talking about the process of bone formation, of course, which ceases most likely at the age of 20 to 21. Okay, so there are different methods of bone ossification. There's what we call intramembranous and what we call endochondral ossification. I know that for the Bsc'S, you may not have covered this, but I'm just, commenting on it in case it comes. So that at least you've got an idea that this is just basically a process of bone formation, which can be intramembranous or what we call endochondral bone formation. Apart from that, you have to know the major classifications of the skeletal system. Talking about the exoskeleton, the skull, right? The thoracic cage, the spinal cord, right? That is the vertebral column. That is the exoskeleton. Talk about the bones of the skull, the sutures. You have to know all those different things. The type of sutures, the sagittal suture, coronal suture, rhomboidal suture. You have to know all those different types of sutures. Talking about the appendicular skeleton, you have to know the upper limbs as well as the shoulder girdle, pectoral girdle. You have to know the pelvic girdle and the lower limbs. You have to know all those different things. In case they bring the upper limb to say label it or draw it, you must be familiar with this. Apart from that, of course, you know that the skeletal system has got an extra component, which is what? The joints. You have to know the classification of joints. The fibrous joints, the cartilaginous joints, the synovial joints. You have to know these. Of course, you also have what you call synovial joints types, where you've got the hinge joints, the ball and socket joints, pivot joints, and other type of joints that, of course, you covered. You have to know these kind of things. You also have to know these particular joints that are used for what? For flexion, extension, abduction, rotation. They are used in different ways. In different ways. If you're talking about fundamentals of nursing or applying this concept, it brings about what we call, excess range of motion, because the person is able to make it different directions using these different joints. Of course, clinical application in the joints will come about. One, arthritis, inflammation of the joints. Next year, this is going to make sense. Dislocations. You find that maybe the bone has, the bone and socket kind of joint. The humerus is not in the, acetabellum, socket. That's bringing about what? Dislocation. You have to know the clinical application, at least, of this particular system. Talking about the muscular system. On the muscular system, again, there's a video in my playlist. Make sure that maybe if you did not see it, review it in my playlist. You're going to find it. you have to know, of course, at least just the types of muscles: skeletal muscles, cardiac muscles, smooth muscles. Of course, you have to know these kind of things. Talking about the fiber structure, the actual myofiber, the actual muscle cell. Of course, I know if you've done physiology, you know that they've got what we call the sarcomere, they've got what we call actin myosin, filaments that bring about contraction mechanism during muscle contraction, right? You have to know the insertion and origin. This is very, very important. Insertion and origin, what they mean and how they're different. You have to know the neuromuscular junction and contraction mechanism. That is if that is physiology. But in case if they still bring if she still brings this question, you may still have to use the same knowledge information in what? In physiology, and talk about the neuromuscular junction and contraction mechanism. Talking about the muscle types, there's a video in my playlist here which talked about the muscle types: the unipennate muscle, the bipennate muscle, the multipennate muscle, the secular muscles. All those different types, the fusiform muscles, you have to know them. Talking about muscle innervation, remember I did guide in the notes that I sent you to say these different muscles are innervated by different nerves. So if at all there is injury or damage to that particular nerve that is innervating that particular muscle, critical application is that there will be paralysis to that particular region of the muscle. Okay? Or there will be, if it's in the eyes, there will be squinting, right? So you have to know muscles are innervated by different nerves of the body. Talking about the muscle groups and the actions, for example, we've got the biceps, the triceps, the quadriceps, different types of muscles. Parallel muscles, they are in different forms, right? Talking about the clinical application, there's what we call muscular atrophy. This is going to make sense in pathology next year when somebody is not moving, they're not exercising. The muscles they do waste, they bring about what we call muscular atrophy, as well as cramps, muscle cramps. I think, this is something that is familiar, especially with ladies when we're talking about muscle cramps, right? Muscle spasms. Okay? So that is what you're supposed to know on the muscular system. So I hope you are following, and I would also like to repeat the fact that what I'm talking about may just not come on the MCQs. It may appear on each and every section. Any section of the exam, it can appear. I'm just generally guiding on the key things that you must not miss out as you talk about it, or as you review or do your final digest on these different systems. Apart from that, talking about the cardiovascular system. Now, this is a system which is very, very interesting. Okay? It's the cardio, that's the heart part, and the vascular part, which is talking about blood vessels, right? You have to know the heart anatomy. How is the heart? How is it structured? The chambers of the heart, the four chambers, the valves, all those different valves, especially the diagrams here. You have to know all the diagrams that I sent that are talking about the chambers of the heart. Talking about the conduction system, you have to know all those different nodes, all those different bundles on the conduction system. If possible, make sure that you practice on how to write the conduction system of the heart. Why is the delay of electrical nerve impulses? Of course, at the AV bundle, at the AV node, that kind of question usually comes. You have to know that, right? Talking about blood flow or pathway, as well as the cardiac cycle. So blood flow and cardiac cycle are not the same. Blood flow, we're talking about how blood flows in the heart from the right atrium to the right ventricle, to the pulmonary artery, to the lungs, back to in the heart through what we call the pulmonary vein, through the left atrium, left ventricle, then to the aorta, to all parts of the body. That is the pathway. Talking about the cardiac cycle, talking about the heartbeat, the lab dab, right? Talking about diastole and systole, you have to review all those things, right? We're also talking about the major blood vessels, the aorta, the vena cava, the coronary arteries. Remember that the vena cava is special white because that's got valves, right, which prevent the backflow of blood. Make sure that you review all these different things. Talking about the blood vessels, the blood vessel layers, the tunica intima, the tunica media, right, the tunica externa. You have to know all those different things. And the differences between the arteries and the veins, very, very important. Talking about the capillaries, this is very, very important. Talking about the types of capillaries, right? The fenestrated capillaries, the continuous capillaries, sinusoidal capillaries. Make sure that you review all those different things. Okay? Talking about blood pressure regulation. I think I talked about the glossopharyngeal nerve type number should be number 9, which brings about regulation of blood pressure. Of course, that is due to detection of what we call the baroreceptors that are found on the carotid artery specifically. Okay, for the BS students, this is making sense because I think you know what I'm talking about here. I thought about this. Okay, how is blood regulated? Of course, sometimes it's regulated using hormones and everything. You have to know all these different concepts. Clinical application, of course, the reason why you are learning about the cardiovascular system is that there is what we call hypertension, heart failure, myocardial infarction, angina pectoris. There are a lot of conditions that you can use to be able to apply this knowledge. Of course, this is going to make sense next year. Talking about the endocrine system, my favorite system of all times. So the endocrine system has to do with hormones, of course. Make sure that you know the major glands. You know the major glands, the pituitary gland, thyroid gland, adrenal gland, pancreas, the thymus gland, the ovaries, of course, including the placenta being a temporal, endocrine gland. Know all those different glands, right? Talking about the hormones and the functions. And most importantly, they want you to know the concept of how insulin, cortisol hormone, how thyroid hormone works, like the T3 and the T4. T3 is what? Thyroid, right? Thyroid, right? Then T4, that's the actual thyroxine hormone. You have to know which one is in abundance here, which one is in few amounts. You have to know all those kind of things. Talking about the GH, that's the growth hormone, and most importantly, like I said, if you're talking about the endocrine system, as you talk about each and every hormone, at least be familiar with a disorder that can come about if this hormone is not working properly, right? You have to know that. Also, talking about the hormone stimulus release mechanism, I've abbreviated for you here. You can see that there's what you call the humoral stimulus mechanism, the hormonal stimulus mechanism, as well as what you call the neurostimulus mechanism. All those kind of things, the feedback mechanisms, either negative or positive. I think I explained this concept in class, talking about negative feedback mechanism and the positive feedback mechanism. Clinical application is that there are conditions that have to do with hormone imbalances, such as diabetes, hypothyroidism, Addison's disease, the Cushing syndrome. There are a lot of them. The chromatism, the dwarfism, gigantism. There are a lot of conditions, right? Make sure that you know all those different disorders as guided. Okay? And then you also have to talk about the digestive system as you are, reviewing your notes or doing your final touches. The digestive system, you have to know that this system is very straightforward for me. Yes, because it's a system that has just to do with the same alimentary canal that you know. Talking about the mouth, the esophagus, the stomach, the intestines, and the anus, right? This is just now in human anatomy a bit advanced. Why? Because in the mouth, they will expect you to talk about the tongues, the structure of the tooth, of which these things you still did at secondary school, right? In the esophagus now, the stomach, they will expect you to know the intestines, the small intestines, the different regions, the jejunum, the duodenum, the ileum, right? They expect you to know all those different, components. If anything, they require you to know the kind of epithelia that lines this GIT, right? So make sure that you know the structure of the tongue, right? You know the structure of the tongue, okay? You know the structure of the tooth. You know how to label the intestines, the transverse colon, okay? The ascending colon, the descending colon, right? The cecum, all those kind of things. Make sure that you know them. Talking about the GIT layers, okay? The submucosa, the mucosa, the muscularis, all those different layers. Make sure that you know them. Apart from that, it's important to talk about the accessory organs of the digestive system, the liver, of course. It plays a vital role in digestion, right? Because we're talking about fat metabolism, bring about bowel production, of course, the liver is involved, right? Talking about the pancreas, secretion of insulin, right, and glucagon, it also plays a role in digestion, right? Also talking about the gallbladder, it's the one that stores, of course, the bowel that we're talking about, which bring about fat emulsification, right? So that's very, very important. Talking about the digestive enzymes and the absorption sites, the ileum, right? This is very, very important. Clinical application, next year we'll be talking about the ulcers, we'll be talking about hepatitis, you'll be talking about the gallstones, or what we call cholelithiasis and everything. So this is why you're just building knowledge on these different systems. Talking about the urinary system, this one is very, very straightforward. Why? Because it just involves very, very few organs. You've got the kidney, right, or the kidneys, right? Two of them, two ureters, right? The bladder and one urethra. So talk about the difference in terms of urethra orientation in males and in females. In females, it's shorter, right? In males, it's a bit longer. Okay? Talking about the bladder, this is the structure that stores urine. Of course, there are muscles that surround the bladder that bring about contraction and relaxation, of course, when passing in urine. Talking about the ureters, okay? These are just basically structures, okay, that pass or transport urine from the actual kidney to the bladder, right? Talking about the kidney itself, know the structure of the kidney, the different types, okay? The different types of nephrons that are found in the kidney, know those kind of things. Know the nephron structure and function, starting from the Bowman's capsule, proximal tubule, distal tubule, the collecting ducts, okay? if you did physiology, this is very simple because you even know how how these different filtered molecules are going to be moving from one point to the other. Are they going to be absorbed or not? Those sodium, influenced calcium mechanisms. How water will be following calcium, how water will be following sodium. That is very, very simple. Okay, so you have to know this particular nephron, right? Talking about filtration, reabsorption, and secretion, you have to know these concepts. Okay, filtration, reabsorption, and the secretion in the renal system. You also have to know fluid and electrolyte balance. Of course, it's done by hormones and actual electrolytes, right? Talking about sodium, calcium, they do bring about fluid balancing in the body. No wonder we give those normal saline, the dextrose stuffs and everything. Ringer's lactate, we want to just promote fluid balancing in the body. Clinical application, UTI, urinary tract infections. We're going to learn about these things. Renal failure, dialysis. Okay, this is the reason why we're learning about the urinary system. Apart from that, the respiratory system, very, very important. Without this system, of course, everything is going to shut down. If you're not breathing, you can't talk. The heart can't beat normal, right? So the respiratory system is very simple, starting from the nasal cavity, the pharynx, the larynx, the trachea, the bronchi, the lungs, the bronchioles, all those you have to know them. Of course, last but not the least, the alveoli. The alveoli, because that's where gaseous exchange takes place. You can see here the alveoli and capillaries. How does blood move from the alveoli into the capillaries, and how does carbon dioxide move from the capillaries going into the blood? Know these kind of things. Talking about the breathing mechanism and control, you have to talk about how the diaphragm works. Does it relax? Does it contract? How the accessory muscles, such as the intercostal muscles, how do they work? The internal intercostal muscles, the external intercostal muscles, how do they work? I think I taught about this in class. Okay, most of these things that I'm talking about, we did cover them. Clinical application, there are conditions that we'll be looking at next year, such as asthma, COPD, right? Pneumonia. There are a lot of things. Atelectasis, bronchitis. There are a lot of things that has to do with the respiratory pathology. For now, just focus on this. Last but not the least, you also have to know something about the nervous system. The nervous system, right? Especially those that are going to major in mental health. The nervous system. How does it develop? So the development of the nervous system, of course, starts it develops from what to call the ectoderm layer. Of course, you also have to know there are three important things that you have to know about the development of the nervous system. It develops from what we call three special vesicles. There's what we call the forebrain, the prosencephalon, right, which gives rise to the telekencephalon and the mesencephalon, right. You also have to talk about the midi brain. You also have to talk about the hindi brain. These are the three major vesicles of brain development: the forebrain, the middle brain, as well as the hindi brain, right, which brings rise to the telencephalon, mesencephalon, diencephalon, all those kind of different regions. Okay, you also have to talk about, of course, just knowing the nervous system in general. I know that you didn't cover this topic in details, but generally, I just have an idea of how does the cerebellum looks. Okay, how is the cerebellum? How is the brainstem? Okay, you also have to know the spinal cord structure and reflex arc. I think if you did physiology, you know how the reflexes works. Okay, but you also have to know about the spinal cord structure, the meninges, the arachnoid matter, the dura mater, right? Subarachnoid matter. You also have to at least look into those kind of aspects. Talking about neural anatomy and impulse transmission, the same concept that you learned in physiology, generation of action, potential, and everything. It's the same concept that you learned. Autonomic nervous system, this is very, very important, especially in human anatomy, because it brings about what we call sympathetic and parasympathetic innervation. You have to know which one is for fight and flight, and which one is for rest. Clinical application, you're going to be learning about stroke next year, epilepsy, meningitis, convulsions. You'll be learning about these things, next year. So make sure that you also review possible diagrams, look at the brain, okay, the structure of the brain generally, it can come. Yeah, you also have to review it. Now, the most important point is that for all the topics above, review the diagram on each topic. So each system that I was talking about, check the diagram that I found on each particular system. What is there? I was not going into details because I was just generally guiding what you have to know on each and every topic, at least the most important things. I may have missed some of the things, yes, but I was just trying to bring out or to highlight the things that you must not really miss as you are doing your final revisions. I wish you the very best, and remember to subscribe to this YouTube channel because it will bring you more of these videos, more of content, and you'll be able to benefit from these different videos. All the very best in examination, and I hope this video has been helpful.